My name is Minh Tran, and I am very grateful to be able to present our study on the diagnostic accuracy of combined multiparametric MRI and transperineal template-guided mapping biopsy of the prostate in the detection of unilateral prostate cancer. This research was performed at St Vincent's Hospital in Sydney, Australia. Over a 2-year period, 89 patients at a single centre underwent in sequential order a multiparametric MRI, a transperineal mapping biopsy of the prostate, and lastly, a radical prostatectomy. Analysis was then performed on patients who met consensus guidelines for focal therapy. That is, 1, their age was equal or greater than 40, 2, they had a PSA equal or less than 15, 3, they had a clinical stage T2A or less, 4, they had equal or less than Gleason grade 3+4 on biopsy, and 5, there was no evidence of extracapsular extension or seminal-vesical invasion on MRI or biopsy. Lobes were then stratified into 3 categories based on findings on multiparametric MRI as well as the biopsy. These 3 categories were 1, lobes with no cancer, 2, lobes with insignificant cancer, and 3, lobes with significant cancer. Lobes were then stratified into the same 3 categories based on findings on their histopathology on radical prostatectomy, which was used as our endpoint. The negative predictive value was considered prospectively our primary parameter of interest due to the risk of undertreating patients with focal therapy. 50 patients were included in analysis as they met consensus guidelines for focal therapy. The median age was 63, with a median PSA of 5.1. The median number of calls collected was 32, with a median positive calls per patient of 7. 37 out of the 50 patients had at least one PIRADS 4 or 5 lesion on MRI. Sensitivity was 97%, specificity 61%, positive predictive value 83%, and most importantly, as aforementioned, our negative predictive value was 91%. 21 patients had significant unilateral disease preoperatively using MRI and biopsy. 19 of these 21 patients had true unilateral disease at radical prostatectomy. So there were 2 patients. These 2 patients had a significant lesion that crossed the midline that was not detected preoperatively. These margins were small at 4 millimeters and 6 millimeters. One of these patients also had a small significant lesion that was not identified on MRI or biopsy. This lesion was considered significant as it had a Gleason 3+4 pattern, however, had low to intermediate risk features, including having less than 10% Gleason pattern 4, and as well as having an overall volume less than 0.1 cc. In conclusion, in potential candidates for focal therapy, based on consensus guidelines, multiparametric MRI and transperineal template-guided mapping biopsy of the prostate provides a high negative predictive value in the application of hemi-ablative focal therapy. Thank you very much for your time.